Now, did you know that according to the mental health charity Mind, 40% of GP appointments are to do with the patient's mental health? Are GPs the right healthcare professionals to be providing this support, or should there be more specialist treatment readily available? James Starkie is a former government advisor and founder of the No Time to Wait campaign, which is calling for urgent action. I'm delighted he joins me now. Hi, James.
Hi,
thank you for coming on the show.
Thank you very much for having me.
You're very welcome. You are joining us, of course, on a bank holiday Monday, so we're even more grateful for that. And since we're talking mental health, couldn't Britain having more bank holidays be good for our mental health? What do you think?
Thanks again for having me on, Gloria. I'm sure it would. I think there'll be a lot of people out today spending time with family and hopefully getting good exercise, which is always a great thing, I think, for mental health.
And I was looking at your website, which is where I saw that extraordinary statistic that we had in the introduction, that 40% of GP appointments are concerned with mental health. What's going on out there?
Well, I think there's a lot. GPs are generally speaking going to be the first port of call for mental health. And as you said, we found that statistic from a survey with GPs, which showed just such a high volume of appointments will be about mental health. And that's why the No Time to Wait campaign wants to see mental health nurses in GPs so people can get that help that much quicker and try to reduce some of those waiting times.
I read that you want a mental health nurse in every GP surgery. It sounds great. There's clearly demand. You used to be a government advisor. Have the government given you any indication about whether they're going to do that?
We've had some great conversations with various people in the sector. The Royal College of Nursing are backing the campaign, Mind are backing the campaign, along with other charities like Beat. And we've also had some initial discussions with people in government just to talk them through what the campaign's aiming to do and why. And I think one of the things that I've found speaking to people in government is there is a willingness to listen for things that can help on the mental health issue. So it would be a big leap to have a mental health nurse in each GPs immediately. There's clearly workforce issues more broadly in the nursing and the health profession. But one of the things we're hoping to come out with in the next month or two is a pilot scheme, which would maybe allow a kind of way into that without having to go the whole leap immediately.
And you worked in government for Dominic Raab, Priti Patel, Michael Gove. It's quite an impressive list. But I'm interested in what impact working at such a senior level of government had on your mental health.
Yeah, well, I did. I was lucky enough to have those great jobs. And when I launched the campaign, I did one of the things I said, because, I mean, it's thinking back over it, it's true, is when you're struggling with things, I'm sure there's people in different professions, whether it's journalism, politicians themselves, people in big business, is you think, how can I be feeling like this when I've got such a great job, when I've got such a great family? And I found that really difficult. And they are high pressure jobs. And I think, and that's why I put at the time, I think reaching out for help is really, really one of the hardest things. And there's so many people that don't. For example, about 2/3 of people over the age of 40, males over the age of 40 who go on to commit suicide don't come into contact with any kind of help or services at all. And that is that issue of people still not reaching out. And I think I feel so lucky that so many people around Westminster actually reached out and offered their hand of help to me, but asking for that help is a very difficult thing.
And would you tell us a bit more about your own personal experience, if you're comfortable to do so?
Of course, Gloria. I mean, for myself, I think I've never spoken about it before, so sorry. I think it was something that built up over time, and that, as I said, for various reasons, I didn't feel like I was able to speak out or go and get the help that really, in the end, I realised I needed. And it was once I'd spoken out and spoken to people that made the real big change. And I was able, and there were, so many people, it was too many to name. And as I said, people are I know there are definitely people in cabinet that really do care about this. And there were so many people during that period when I was going through difficulties who were supportive, who helped me find help. And that's that's the main reason really I wanted to launch the campaign, is I think there are some people who don't have that support network. I'm very, very lucky. And I also found it very difficult to get support on the NHS, which in the end I went, and now when I require counselling, I do that privately because it's much quicker and easier. And I think, it's not right that people wait, because that is a real danger area. And, the more we can do to get people at an earlier stage before things become so difficult, I think it's better for them, and I think it's better for society.
Thank you, and thank you for opening up too. If I may, because you were a Westminster advisor, the culture at Westminster is really under the spotlight at the moment. It sounds like the Wild West, to be honest. Bullying, watching porn, taking drugs, sexual assault. What's going on? What needs to change?
I think my own experience of Westminster is that, I think, as John Rentoul said earlier, there's a lot of great people in there. I'm sure things have progressed. I've only worked in Westminster for the last 6 or 7 years. I think it is a strange culture compared, having spent most of my working life in other areas. It's a very strange culture in the sense that you tend to socialise a lot with people you work with. The hours are odd. You're an MP yourself, you'll know this better than I, but, those kind of strange hours that you're voting late, your kind of working week is completely different from anyone else's. And I think the way that your social circle and your friends are very much part of your work environment, that's the way that it is. But I think it does make it tricky. I found it difficult at times. And then when you add to that the pressure that exists on various jobs, whether you're a special advisor, whether you're an MP, whether you're a journalist, that they are high pressure jobs. I've done a few jobs, and I'd say it's probably the most high pressure I've experienced. And I think if you combine those things, then things can happen. I think the more that can be done from a kind of HR well-being perspective to help people and to allow people to have a route to help that they feel confident in, whatever the issue may be, I think that would improve things.
James Starkie, I've really enjoyed talking to you today. I hope you come back on the show again soon. Thank you. Thank you.